Thank you for tuning in today. Today we're going to be talking about healthcare. We're going to be talking about construction. We're going to be talking about the future of healthcare. And we're also going to be talking about the Izzo Family Medical Center, which is located at McLaren's campus. Stay tuned. We have a new jewel in our community, and it's something you want to hear about. And to talk about that new jewel and that diamond in the rough, we have two of our distinguished community partners with us today. Kirk Ray, who is the CEO of McLaren Greater Lansing, and also Pat Gillespie, who is the CEO of Gillespie Group, who's doing tremendous work in our community. Now, people see the two of you sitting here and they think, okay, what's this connection? Healthcare, construction. Talk a little bit first about, before we get into and showing some of the video for this new Izzo Family Medical Center, which is phenomenal and what it does. First, talk about you, Pat, and how you got involved with the work you're doing. And then, Kirk, I want you to talk about how you got involved with healthcare and then how the two of you got connected.
That's a good question. So I've been a real estate developer in the Lansing area for about 27 years. Very passionate about our community, very passionate about public-private partnerships, working with cities and municipalities and businesses to grow, to do creative things, to do unique things, whether it's housing or grocery stores or hotels or office buildings or old train stations. So that passion led us to keep developing in Lansing, keep investing in our region and around the state. And it only became natural to communicate with the folks, Kirk Ray and his team at McLaren. I think we met in Mackinac Island a couple of years ago at the Chamber event, probably 4 years ago, and they were doing some amazing things, planning a new hospital, planning a whole new healthcare system for the Lansing area. And it was just natural for us to say, what can we do to help? What can we do to collaborate with you? How can we put what you're doing on steroids and interact in some way? And after a lot of conversations, the Izzo Family Medical Center is the result of that. And excited to talk about it today and have Kirk tell you all the great things that are happening there. But it's a win-win partnership, and I think it's been great, and we're hopefully be able to do more in the future.
And that Izzo Family Medical Center doesn't just impact Lansing, it impacts the entire state of Michigan. We'll be hearing more about that and seeing some video also, some B-roll from that was taken of there. So Kirk, you've been in healthcare business you've been in Lansing now for how many years?
5.5 years.
And just for full transparency, I am vice chair of the McLaren Greater Lansing board, but that has nothing to do with the two of them being here, all right? All right, so 5 years. So tell us a little bit how you got
Yeah, first of all, when you said distinguished, we had to do a double take there. I've been here 5.5 years, and what really drew me here, I've been in healthcare for a little over 30 years altogether. Started out clinically, and then eventually had operational responsibilities for a little over 50 different markets around the U.S. before coming to Lansing. And the attraction was the opportunity to work with the Big Ten University, with Michigan State, opportunity to build a large investment, which ultimately became a $600 million investment for this region. And those are opportunities you don't come across in healthcare. I mean, it's a capstone opportunity that you get once in a lifetime in most cases. And so it's been phenomenal. The community was very welcoming, as Pat indicated. We met up at the policy conference at Mackinac a few years ago, and that really just started the conversation about how we could come together as community leaders and do something really special. And that's what resulted in not only the new campus, but most recently the Izzo Family Medical Center.
Well, you talk about a $600 million building, but it's more than just a $600 million building. The kind of partnerships that have been developed, the people who are connected. You've been talking about Izzo, you've got Kermanos, you've got Grand Rapids, you've got other folks connected with this. Talk a little bit about some of those partnerships.
Yeah, a lot of that, a lot of people were really focused on the bricks and mortar aspect of the campus, and there's so many different components, not just the hospital that were built there. It was about developing relationships, primarily with Michigan State, Helen DeVos Children's Hospital. They now have a very big footprint here in the Lansing region more recently. And so those were things that we wanted to bring to the community through partnerships, so patients didn't have to leave the Lansing area to go get those services. And it was all about creating more access.
And that takes as much labor and work as building the bricks and mortar, just making those connections, which is something you're masterful at, Pat. I mean, you've been doing that for a very long time. So to have Izzo's name, and I asked him at the grand opening, I said, is your name on any other building in the state of Michigan? He said, it might be in a gym somewhere up, up in the UP, but this was a big deal for him. How did he get involved, and what was the connection there?
Well, Tom and Loopy are very good friends, and they're always asking, what are you up to? What's going on in your world? Just like I ask, how come you lost or how come you won? So it's kind of a good conversation. But I was telling him about the medical center that we were working on next to McLaren. that had to do with Helen DeVos Children's Hospital. It had to do with kids, had to do with community health, had to do with women's health. And they were really interested, and they said, how do we become involved in something like that as an investor? So it was a casual, but as they learned about all of the partnerships and collaborations that were going on, their eyes got big and said, this is really impactful for the area. And in their humility, I said, hey, what if we had this named the Izzo Family Medical Center to honor everything you guys have done in the community and your impact on the community? And we don't want to do that. That's not up to us. And push came to shove, and it ended up being that. And I think
Push came to shove with Tom, right?
With Tom, yes. But it turned out great. They're very excited to be a part of it. And as you know, they've done so many things for the community, most of which people don't know about.
Exactly. That's how they prefer
and it goes on every day, and that is how they prefer it. And so it's kind of out of character for them to have their name on a building, but I think the sense of pride, and I do think the community having it there and driving by and seeing the name affiliated with all the collaborations you've done just adds it's like a feather on the cap there.
Right.
And it's really, really nice to have it honor the family.
Absolutely. And I mean, Lupe and Tom both have been extremely involved with our community ever since they've been here. But let's talk a little bit about what happens inside that center. It is, and again, I know a lot of this information, but it still blows me away to think about it. It's one of a kind.
Yeah, it's really special. And that conversation started a little over 4 years ago with Michigan State. We did an offsite retreat, and leadership from MSU Healthcare and McLaren came together and said, well, we do things extremely well, but we do them in silos. And if there's a way that we could put this together to create something that's extremely special, not only for clinical results, but for academic results as well, that's where we ended up coming up with a joint ventured imaging center concept. And that's what ended up being the primary footprint in the new Izzo Family Medical Center. And so that was bringing all of our assets around imaging services together, bringing the latest technology, the latest innovation. We have actually 4 wide bore MRIs in that facility. That's in one site. There's no other site like that in the state of Michigan to have the imaging capabilities. That created access, the opportunity to put next day imaging procedures on schedule, gave us the opportunity to eliminate discomfort with imaging services, because MRIs typically is not the most comfortable imaging procedure you're gonna get into. Personally speaking, I usually have to take something before I get into an MRI, but that wide bore creates a lot more high level of comfort for those that have issues with getting in tight spaces. And then the biggest piece of that around access was really reducing the amount of radiation exposure during a procedure. So the new technology has shortened the time for imaging procedures, and it's eliminated a lot of the radiation dose, not only for patients but for staff. You see them walking around with lead vests on typically, and you think, well, why don't I have one? I'm going in. But that's part of the procedure. But that was one of the biggest things, was to find a way to reduce radiation to the patient, and so that gets them out a little bit quicker, and it's a lot safer for the patient.
I remember the story of the young girl who was there at the grand opening of the building. So it's not just for older adults, but talk about imaging and all the different facets of imaging. I mean, people get imaging because this audience knows imaging, but they may not know exactly what you're talking about. So break that down for us a little bit.
So there's all kinds of different procedures under imaging. With MRI, really looking at its high resolution to find tumors and things like that. The PET CT is another one of those that's really for cancer related imaging services. And then the relationship with Helen DeVos is really a special one. That was years in the making, in trying to get them to bring more pediatric solutions to the Lansing community. And so there are a multitude of pediatric subspecialties that DeVos has available in that building that patients used to have to leave the community for. Things like pediatric cardiology, neurology, neurosurgical, pediatric nephrology, the things that you just really don't think about. But they also have the capability to have those imaging services right there in the building. So we kind of set it up as a one-stop shop so parents don't have to leave the community with their children. And that's what they were talking about around access. And that was the whole concept behind that relationship.
And to get the results back within like 24 hours, that's almost unheard of. And that's part, I think for me, that's always the agonizing part, when you have to wait and wait and wait. But to be able to be more comfortable when you're getting your MRI, and also to get the results back in a very short period of time is... Yeah.
And a lot of people don't know what happens behind the curtain. So once that exam's done, that could go off into nebulous. And so that took as much work putting what's called our PACS system, which is the reading of those images once the results come in for those radiologists. In fact, the radiologist could be sitting in Hawaii and read those images immediately after the procedure is done and electronically sent back. And so they don't have to be on site to be able to do that type of work.
That's incredible. We want to talk a bit more about what's going on, other things that are going on at McLaren as well. But before we do that, Pat, let's talk about what's going on. What other projects do you have going on here that impact our community?
Well, Lansing and Grand Rapids is a focus for ours right now. Lansing, the 120-year-old train station is almost done with another new restaurant. The old Sears building right near Frandor, near MSU's campus, a couple 100,000 square feet, 14 acres, hoping to bring that back to life in the next 24 months with some dynamic restaurants, entertainment, higher end retail.
Oh, nice.
Yeah, so that's going to be an exciting one. Very visible from the highway.
You might want to consult with me about the retail stores that you want to try to attack.
Seeing your shoes and dress, I think we're talking the same type of retailers.
Okay, all right, good.
So those are big ones we're working on. And then in Grand Rapids, we're working on a couple of exciting projects. We haven't done a lot of projects in Grand Rapids, and we're working on 2 down there right now with some, once again, great collaborators, great other companies that are present down there that we're getting to know and really work hard towards bringing that forward. So the next 24 months should be pretty dynamic in both towns for us.
And both, we talk about Izzo, but also Grand Rapids has some tremendous supporters who give to the community all the time. So having them involved with Lansing involved with Grand Rapids, it's just good. It's not territorial, but it's whatever's best for the region is what we all want. We all should want anyway. Not this is mine. And so I like the fact that we're crossing city lines and region lines and working together to do what's best for the region. So let's go back to the Image Center, and there's some video that's being shown about what's happening in there, and it's beautiful. It's a beautiful, beautiful space. But not only the Image Center, but the hospital itself. In the 5 years that you've been here, talk about some of the changes that have taken place in terms of growth.
A lot of evolution. First, I wanted to say that the work that the Gillespie Group does for this region is phenomenal for us when we're trying to recruit physicians, talented physicians from all over the country. When we can bring them in there and they can see the assets that are being developed here or have been developed, and a lot of that's due to Pat's work over the years, really helps us from a recruitment standpoint. And so it's great having a partner like that in the community that can develop and build.
Hiring new doctors.
That's right, and bringing them in, because it does strengthen the community. And I think, as you indicated, with the ties to Grand Rapids, I think all boats rise when you're working together. And so,
and the DeVos family has done tremendous work in Grand Rapids and all over the state. So
absolutely,
yeah.
But the development of the campus, it's just been an evolution. So again, it wasn't just the bricks and mortar that drove that. It was the collaborations. It was the development of key service lines and creating more access. I.e., our Carmanos Cancer Institute. That was a thought 4 years ago, and now we have one of the top cancer NCI designated programs in the country right here in Lansing, and that's in a collaboration with all of the oncology work that's being done at MSU, and that's great for citizens of Lansing to be able to have access for those types of services. Our Heart and Vascular Institute, that's been continued to be developed. We've helped, in collaboration with Michigan State, recruit some of the top vascular surgeons in the country here that are in development of a limb salvage program, and then something we haven't announced to the general public yet. So this will be new and coming out. We've invested in some AI technology for high-end endovascular cases. We'll be the only one in the state of Michigan offering that technology. It'll actually shorten the surgical time for patients. It'll reduce the amount of imaging radiation dose during the procedure because it's a hybrid case. And so that's going to be launched here in the next couple of weeks. And it's one of only 20 sites in the United States that are going to have that technology, and that's going to advance our heart and vascular services even more. So those patients typically they would have to drive to the Mayo Clinics or Cleveland Clinics of the world to have that type of surgery done.
How exciting! Yeah, I was going to ask both of you about AI and the role that it's playing in your businesses, because everyone's talking about that right now like it's something new. It's been around for a long time, but it's just more accessible now. But I want to talk a little bit about the robots too. Some of the robotic technology that's at the hospital and healthcare in general. Surgery's not always as invasive as it used to be as a result of some of the robotic and technology that's available. And I was blown away when I saw some of the equipment that's in there. It is like top of class. It's the best there is.
Yeah, and a lot of those decisions, again, were made on what's going to be best for the patient recovery time. Minimal invasive procedures have been around for some time, but the advancement of the robot, we actually operate with the Intuitive XI robot. We have 3 of those on our second floor OR platform. I think we're on pace to do about 1,300 robotics cases this year just on soft tissue cases. And then this last year we launched the Mako robot, which is for orthopedic cases. And I think we're on pace to do about 500 orthopedic cases on the Mako this year. And again, those were new, I guess what I call accretive cases to the hospital. A lot less invasive, more less incision, and the recovery time and the opportunity to get an infection is a lot less or degraded, I guess you could say, by doing those types of cases. Again, those were things that patients would have to leave the community for, and it's great to be able to offer that.
Absolutely. It's a little scary when you see a robot, not a person with a gown and the other doctor with a hat, but you go, okay.
The precision is incredible.
The precision and the opportunity for error is significant with robotics and technology.
When they model that, sometimes they do origami with a chewing gum wrapper, and it ends up, they can make a swan or something. Yeah,
it's amazing.
It's precise.
It's amazing. Yes, it's amazing. I watched an open heart surgery there some time ago, and I thought I was going to pass out because I was going to cut them, and open it. They don't do it that way anymore. So it's just phenomenal, and the work that's gone on. And congratulations on all you've accomplished in the short time that you've actually been here. What role is technology playing in your business, Pat? I mean, everyone's evolving.
Not as invasive as heart surgery, but AI is really starting to be a lot of front stage stuff. If someone calls us for an apartment and it's 2 a.m, they're on their phone or they're making a call, they're talking to someone, they're setting up an appointment, they're looking at apartments, AI is doing all that. So there really is no 8 to 5. I want to see an apartment, they can see it through video, people can show them, the AI will show them what they want to see and basically get it set on a tee. Same thing with retail space. I'm looking for something and they don't, it could be any hour of the day, any time, and someone is answering them. We always have a human behind that to, help follow up after that, but it just keeps it going so they don't go somewhere else or they can get the information when they need it.
That's incredible. We talk about AI like it's something new, and I mentioned that before, it's been around, but there is something called the psychology of space now that, it's a different kind of space that people want to be engaged with. It's not the old cubicles in the office or even apartments and residences are different.
They want instant answers too. So if someone's not answering the phone, they want the information or they'll call somewhere else and get it. So if you can be on it and give them what they need when they want it, which is usually immediately, in today's world, that's what they expect.
What are you seeing some of the changes as we look at space in general? I know we're kind of getting a little bit away from healthcare, but what are you seeing are some of the major changes in terms of what people want when they're looking for an apartment or a condo or retail?
The number one thing we're seeing is that office has changed dramatically. Used to have these big open areas with cubicles and maybe 10,000 square feet. Now I think that office needs to be 5,000 square feet. It needs to be soft seating. It needs to be come and go, interactive when you're there. We're seeing a lot of folks want to downsize their office, but they still want an office and they want it to be more socially engaging. We're trying to figure out what that looks like because socially engaging means different things to different technology is different than real estate brokers, different than insurance people. So they all want some form of social engagement to let people interact without having to try. So we're seeing that in almost every phone call we get and every visit we get. I bet you're probably seeing that in medical. Folks just want to interact because when they are home, they're isolated. And when they're at work, they don't want to be isolated in a cubicle or their office. They want to interact.
And that's what we're hearing as well, that socialization from being in the office and having the time and the space to interact with people, but still having a place to go.
Yes.
That's your own. You can hang a little picture or put something that's your own space. See, I'm not that person. I'm on the opposite end. I want the door closed. I want to be able to pull the shade and then go out. But that's old school. I realize that. So I'm trying to adjust. I'm admitting, I'm learning with everybody else. I'm trying to adjust. But it is different in terms of the atmosphere and the environment, which does translate to healthcare, because I know that you have, individual individual rooms now? I mean, how you built the hospital, how McLaren built their facilities is a lot different than perhaps it used to be before. So when someone goes into a hospital room, what should they expect in that room?
Yeah, it's really changed. Our design changed multiple times too. The pandemic forced us to create some changes with the design and pivot during that period. But all private rooms designed for family to be part of the care at the back of the room, and our clinical caregivers at the front of the room. The technology elements you talk about, what used to be those whiteboards where you'd have the nurse write every shift, that's all electronically fed from the electronic medical record. So when the patient comes in, it's already populated with all of their medications listed right there. That actually helps prevent errors. If they're bringing home medications with them, they're going to contraindicate with certain medications that they're getting while they're in the hospital. So there's a lot of good technology happening there. And then education is a big part of care. And so there's a lot of educational offerings while they're in the hospital with those electronic whiteboards specific to their disease process, so that the discharge planning and discharge disposition is a lot clearer for the patient and the family members. Because most times patients only take in about 10 to 20% of what their discharge instructions are, which ends up landing them back in the hospital if they're not compliant once they leave the hospital. And so the more we can do with education technology while they're there with their discharge instructions, the better they're gonna do once they leave the hospital.
And I love that. And we advocate for that here at AARP too, that whole caregiving. You know, it may not be your sister, your brother. It might be my next door neighbor's my best friend, and I want them to be involved with my discharge instructions. And so being able to sit down and go over and select who I want to help me is really important. So, and the readmissions, like you said, it minimizes the readmissions. We've got about a minute left. Talk to me. What do you want people to know?
I guess everyone talks about the state of the economy. I do think Lansing and Grand Rapids and the state of Michigan is meandering forward. We are moving forward. We're not sideways. We're not going backwards. We could use more of it, and it takes a community, and it takes everyone working together, like collaborations like this to make it go.
I love that. Kirk?
Yeah, I think it's
seconds.
for us. It's going to be continuing to create access, more primary care. And continue to expand our footprint here in the central Michigan region to the west as well as the east, and provide that health care for those that need it.
And I love what you always say. It's about not even needing health care to begin with, so take care of yourself, right? Prevention. Appreciate both of you, not just today, but for all that you do for our region and just for who you are as people and as young men. Young men, do you hear that? Thank you for being here. Thanks for
Paula.
being here.
Thanks,
Appreciate
Paula.
that.
Appreciate
and
it.
thank you for watching AARP Real Possibilities. Hi, Chris. Good to see you. We've seen so much involving nursing homes through COVID and post-COVID, and the cost is just continuing to eat away at many families. How can people protect themselves against nursing home costs?
Yeah. Nursing homes these days are running about $10,000 to $15,000 a month, and we have two strategies to try to protect families and make sure they get the best care possible. So first, by planning ahead, there's certain types of trusts, we call them asset protection trusts, where we can move the assets into the trust. And then if we can make it 5 years before we need a nursing home, then everything inside of that trust is protected from that nursing home or Medicaid spend down. Because Medicaid is a program that can pay for your nursing home care, but a single individual can only have $2,000 worth of countable assets, basically everything other than a home. A married couple at most could have $120,000. And then Medicaid looks back 5 years to see if you moved any money around, and if you have, they're going to penalize you. So there's certain types of trusts, not your basic revocable trust, but an asset protection trust, where you move the assets into the trust, you make it that 5 years, and then now you can have Medicaid pay that cost of care. You have a pot of resources available to pay for additional services to improve your quality of life. Then if you're a married couple and one spouse needs long-term care, the healthy spouse isn't completely impoverished having to pay for that care.
And people should start planning that as soon as possible, because you just never know, regardless of age, you just never know. We might need that additional.
Right. The earlier you start planning, the more options you're going to have, and we can maybe make it that 5 years. Now, the flip side is if you have a loved one in a nursing home now, there's things we can do as a certified law attorney at the last minute to try to protect resources. We call it a Medicaid crisis plan. So there's situations where maybe we can protect half of the assets versus having to spend down to that $2,000 asset limit.
And that's devastating for families when they have to get rid of their home in order to put someone in a nursing home.
Right.
So thank you. Appreciate that.
Thank you.
All right, today I'd like to talk to you about exercise as medicine. Exercise has been shown to be beneficial in the treatment of 26 different diseases. Here are some ways that exercise might benefit you. Exercise can reduce and prevent depression and anxiety. It can improve short-term memory. It can improve your mood by releasing endorphins. It can increase your lung capacity, your strength, your balance, and your endurance. It can help to prevent falls and fractures. It can help to prevent obesity, diabetes, high blood pressure, and high cholesterol. It can help reduce your blood pressure for up to 4 to 10 hours after exercising. It can release substances that target tumor necrosis factor and rheumatoid arthritis inflammation. It can help improve osteoarthritis pain and function, and may release substances that reduce inflammation and cartilage loss. It can help to decrease stress and stress hormone levels and improve how we respond to stress. It can help stimulate nerve cell growth and health. It can help prevent dementia and certain cancers. And any kind of exercise is really going to be okay. Strength, resistance, or cardiovascular. You should talk to your doctor before you begin an exercise program. Exercise is tolerated and as comfortable, and make sure you avoid exercising on an injured joint, or if something hurts, modify the activity or stop the activity. Thank you.
Talking about transportation with CATA. Thank you for being here, Lolo. Appreciate you being here today. A lot of times people have mobility issues and they can't access CATA, regular CATA vehicle the way that other folks can. What options do they have?
So all of our buses are equipped with wheelchair lifts and access for those who are, mobility challenged and need some assistance in terms of boarding and alighting from a vehicle.
And if they didn't want to ride a regular CATA bus, there are other options as well, but they'd have to schedule those?
That's correct. They can call our paratransit dispatcher and get those trips scheduled, and that service is, again, curb to curb, arrives right at your doorstep, and you board the bus and it takes you right where you need to go.
And so what's the difference in cost and convenience between the regular CATA bus and using the mobility accessible wheelchair ramp or the curb to curb? What's the difference?
Fixed route buses are the most affordable. It's either $1.25 per trip in one direction or 60 cents if you qualify, if you're eligible for it. The other option is Spectran, and that is $2.50 per one-way trip.
Well, that's very reasonable, particularly with the cost of gas. So when you say 60 cents, what's the difference between if I qualify for the 60 cents ride versus the $1.25 ride?
So in terms of our conversation today, 60 cents would be applicable to senior riders, and they would just need to get a CATA card, CATA Club card, and that would be what they show the operator when they board the bus.
Excellent.
And they get that 60-cent fare.
We need to make certain that people know about that. And so the senior is starting at what age? 45?
65.
50? Oh, okay. I was just
Yeah.
at 65 years old. All right. So that's news that you can use from CATA. Thank you for being here today. Thank you for watching. Take this information that you learned today and share it with someone else. Hopefully you got some news that you can use. Thanks for watching Real Possibilities.